Of Daytime Tri-Cities is sponsored by ETSU Health. Stroke is a leading cause of death and long-term disability worldwide, with 1 in 4 adults over 25 having a stroke in their lifetime. And this morning, we want to welcome Dr. Katie Masters and Dr. Alora Ricker to Daytime for a conversation about stroke awareness. Good morning, doctors.
Good morning.
Thanks for being here. Dr. Masters, let's talk about, first of all, what are some of our viewers, what are some symptoms that they need to be on the lookout for when it comes to stroke?
So I think a really good mnemonic for the common symptoms of stroke would be B fast. So the B is a sudden change in balance or coordination. The E is for eye, so if they have sudden vision loss or blurriness. F would be face, so sudden either numbness or like facial droop. A is arm, so arm weakness or numbness again, and that extends to the leg. And then for S, it would be speech, and that's both producing speech and understanding speech. And then the last one is T for time, and that's just because if you notice those symptoms, it's important to get to the emergency room as fast as possible.
And Dr. Ricker, not all strokes present in the same way, is that true?
Correct. So those are the classic symptoms we certainly do want everyone to know. That being said, there's a type of stroke called a posterior stroke that more commonly presents with balance and vision issues.
Right.
So people who have a posterior stroke typically have sudden severe dizziness, trouble walking, balance issues, or double vision. And so this is something really important to me because I actually had a posterior stroke myself, and I didn't have those classic symptoms that Dr. Masters talked about. So now I think it's really important to educate people that, hey, not every stroke looks the same way, but it's just as serious and important to seek medical evaluation.
And that leads me into my next question. When do you say, hey, we need to go to the emergency room?
Yeah, so I would say if you noticed any of those symptoms from the B fast mnemonic or like a sudden change from the norm,
right,
it's really important to get it evaluated as soon as possible.
Better safe than sorry.
Exactly,
Yes.
yeah.
All right. Now, what are some of the ways that we can help reduce our risk of stroke?
Yeah, that's a good question. And the ways to reduce it are actually very manageable. So first and foremost, blood pressure is really important,
Right.
as well as managing cholesterol, living a healthy lifestyle, staying physically active, and avoiding tobacco and nicotine use. It's also important to manage chronic conditions like heart disease and diabetes. And I think that's one of the reasons it's so important to have a primary care doctor.
Right.
So you can manage those things, talk about them, reduce that risk, and then screen for things when indicated.
That relationship with your primary care doctor is so vitally important in this chain of making sure that we're taking care of ourselves health-wise.
Exactly, yeah, I would say it's a lot less costly both from an emotional, physical, and financial standpoint to go the extra step to prevent rather than actually suffering from a stroke. Yeah.
What is one last piece of advice you want to give to our viewers right now when it comes to stroke and stroke prevention?
I think if you're ever not sure what to do, I mean, reach out to us, reach out to your primary care doc. Ultimately, our job is to guide you. You know, we know your baseline and other things. And if you're not sure, just be on the safe side and get evaluated by someone.
Right. Dr. Ricker, Dr. Masters, thank you for dropping by today. Great information we can all use. If you need more information, though, you can go to etsuhealth.org. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.